Hello everyone, today we are going to talk about cervical cancer. Cervical cancer is a cervix cancer. The cervix is the uterus' lower thin entrance. It connects your uterus to your vagina. When seen via your vagina, your cervix resembles a donut. Cells in the cervix can occasionally alter and stop growing or behaving properly. These modifications can result in non-cancerous benign tumors such as polyps, cysts, and fibroids. Cervical cells changes can potentially result in precancerous diseases. This signifies that the abnormal cells are not yet cancer, but if they are not treated for a long period, they may develop into cancer. Cervical cancer typically develops over time. The cells in the cervix alter and expand fast during this period. In this video, we will discuss breast cancer risk factors as well as how to identify and treat it. Our role today is to answer most of your questions regarding cervical cancer. Today we have Doctor Bae, who is the leading doctor at Hanyang University Hospital. He's going to discuss with us everything about cervical cancer from the experienced medical point of view. Hi, I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Alright, moving on to cervical cancer.
Yes.
What is cervical cancer?
The uterus has a body, the neck, and the entrance to the vagina is called the cervix. And cancer that develops in the cervix is called cervical cancer.
Who is most at risk of cervical cancer?
There is a definite risk factor for cervical cancer. It is the human papillomavirus, and more than 99% of cervical cancer is caused by long-term infection of HPV.
HPV.
Yeah.
So what is HPV and how is it related to cervical cancer?
HPV is a sexually transmitted virus, so most of it is transmitted through sexual intercourse. However, not all infections lead to cervical cancer. Among them, there are high-risk and low-risk groups. Most of them subside naturally, but it is said that cervical cancer can develop if they don't go away and remain continuously for 1, 2, 3, or 4 years.
What are the stages of cervical cancer?
Similar to other types of cancers, it is divided into stages 1, 2, 3, and 4. Stage 1 is confined to the cervix. So for most stage 1 cancers, surgery is possible. Stage 2 is when it invades the vagina. Stage 3 is when the surrounding organs and the ureter are invaded. And stage 4 is when it spreads to distant organs such as the bladder or rectum.
So is cervical cancer, or does cervical cancer doesn't have any symptoms as well?
Cervical cancer does have symptoms. The most common symptom is bleeding. The most typical case is bleeding after sexual intercourse. As it progresses, symptoms such as foul odor or smelly vagina, secretions can be observed. If it gets worse, the ureter may be invaded, and it may be uncomfortable to urinate. And other symptoms such as back pain and so on may occur.
Let's move to the treatments. What are the available treatments? I know there is surgery, but are there any other treatments for cervical cancer?
Yes.
Surgery is performed from stage 1 to stage 2A. That is, in cases where the vagina is only slightly invaded. And if it exceeds that, there is some controversy for sizes exceeding 4 centimeters. In the tissue around the uterus, called the perimetrium, radiation therapy is a treatment of choice. Radiation therapy shows a survival rate comparable to that of surgery. So from stage 2B, radiation therapy is considered standard. Until then, surgery is performed, and depending on the results of the surgery, radiation therapy may be added.
So after the surgery and after the treatment, is there any specific diet or lifestyle somebody should follow?
Actually, for gynecological cancers, there is little evidence that lifestyle changes after surgery or treatment prevents cancer reoccurrence. The same goes for cervical cancer, ovarian cancer, and endometrial cancer. Exercising regularly and controlling your diet, although in the case of cervical cancer, it may not be that important. Proper diet and exercise, I think, will help.
Today we learned a lot about cervical cancer and the doctor spoke over everything in depth, including the science, diagnosis, and treatment options. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.